All new tonight at 6, it's been an ongoing dispute between Kentucky Democrats and Republicans about the state of your health care. Democrats sounding the alarm over those Medicaid cuts, saying the rural hospitals will close as a result. Republicans argue they're putting more attention into reforming a system that's just not working. Our Isaiah Kim Martinez reports from South Central Kentucky in Danville, where one hospital shares their situation.
Because of our position in South Central Kentucky, where there's a lot of small hospitals that provide great emergency care but don't have a ton of specialists, we're working on being able to provide more of that specialty care.
A rural Kentucky hospital system is cutting back on spending, possibly putting plans for a new patient building on hold.
We're not going to be able to spend on capital and replacing aging infrastructure quite as quickly.
Ephraim McDowell Hospital in Danville, an hour and a half from Louisville, is prepared to make tough decisions in the face of losing $45 million in federal Medicaid reimbursement money over the next decade.
Rural hospitals are going to have to change.
It stems from cuts made to the program in President Trump's big beautiful bill from last summer. Is that detrimental to operations?
It will be a challenge.
Lucas Brooks is Ephraim McDowell's Vice President of Strategic Operations. He tells me the hospital system, which serves more than 150,000 people in South Central Kentucky, will have to do more with less in the years to come. But he assures me they will not close as a result of the cuts, and patient services will not suffer.
I'm not concerned about the access to care that we will be able to provide.
It comes as some Republican lawmakers on Capitol Hill praise President Trump for his moves on rural health care. This moment coming from a Mississippi senator in the Oval Office after Trump's signing of the latest federal funding package.
There's a little hospital in here, a rural hospital in Meadville, Mississippi, called Franklin County Hospital. It would have closed the end of this month without this bill. Thank you from everybody in Mississippi, especially Franklin County.
In the big beautiful bill from last summer, Congress poured $50 billion into reforming rural health care to offset the slashes to Medicaid. Kentucky got more than $200 million of that, but there are still questions from the hospitals themselves.
How is exactly that going to be allocated?
Meanwhile, Brooks says with rising health care costs, this moment is a wake-up call for Kentuckians to eat better. The Food is Medicine initiative is gaining steam both in Washington and Frankfort.
We're trying to prevent diabetes and heart disease.
That area of Kentucky has always been a nice growing area of Kentucky. So as the hospital gets demands but has to make cuts, are they just sending people off to the bigger cities like Louisville and Lexington?
Well, they say they're not doing that yet. Right now, we're just talking about renovations that are being put on hold. So old buildings, potentially, maybe you have to push off those renovation projects a little longer. As far as the demand, we know Louisville and Lexington already get a ton of people. And really, there is no room to basically funnel people anywhere. All these hospital systems are very, very busy, which is why this is such a concerning issue.
And they're saying they didn't want to have them come to Louisville, Lexington, try to take care of them.
Well, they don't want to increase the demand on those big cities, no doubt about it. But they also said they can take care of all the patients that they need to.
All right. Thank you, Isaiah.